you that don't know me, this is a little bit about my background. Every one of those pictures is me. It shows you that Father Time and Mother Nature can really wreak havoc on someone's face. But that's me. Top is when I was a student. Bottom left is when I was doing comedy at Carnegie Hall in New York. Bottom middle is when I was a paramedic while I was in school. The bottom third picture is me giving a TED Talk. And the picture at the top right is me with my good buddy Jack. Jack is a donkey, and some people like to say there's two jackasses in that picture. I don't like to say that, but some people do. Anyway, this is a little bit about me. My focus, guys, is faculty development and CPD. And within faculty development is how do we make them better interprofessional faculty? And within CPD is how do we make people better lifelong learners? And I think that's consistent with the questions that came up. As I said, one of my favorite things is interacting with the student task force. This is a picture of Ujwal. This was the presentation skills session 4 years ago in Barcelona. I do that every few years. And if you notice, that back table is all STF folks who were not assigned to a session at that time. And they came in and they asked me if they could come in and sit in, and I gave them their own table. Because as you remember, I don't stop anybody from coming in. Even if they didn't pay, I don't stop them from coming in, because I love to teach and I love to be able to help people be better teachers. This is one of my favorite quotes. And I think if you take it to heart, when you think about being a lifelong learner and being open to learning is important, but being open to learning, you need to know about yourself. And the more you know and recognize about yourself, the pluses and the minuses, the more you can start a wise professional journey. And this is all about your professional journey. And the questions you've already submitted are so fantastic because you're already thinking about that. Now, that's me. That's not my AMEE avatar. My AMEE avatar makes me look a bit like Walter White, but this is my Bitmoji, and I think this looks a little bit more like me. But let me tell you what the rules are. This is all about you. So Ala is watching the chat box, and Ala, if a question comes up as we're going along and you think I should answer it at that point, ask it then. We don't have to wait. Because you know this, if you're sitting in one of your lecture halls or virtual lecture halls these days, and someone's presenting and you don't understand a subtle point, and the rest of the lecture is based on that subtle point, then you're lost for the rest of the lecture. I'd rather answer the question when it comes up than wait until the end and say, okay, now it's time for questions. And you could say, well, I have a question about something you said 2 minutes into the webinar. I'm happy, Ala, if you have the power. If you see a question come in, you can ask it. But as I said earlier, please, 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 please. That's 4 pleases. I never use 4 pleases. 4 pleases to interact, because I want to make sure that you leave this webinar saying, this is the best one we've ever had. He answered all the questions I had, and I didn't even know I had questions. He created a teachable moment. So let's talk a little bit about what we mean by interprofessional. I'm pretty sure you guys know, but there's a lot of literature out there and there's very little standardization. A lot of people confuse, not you guys, but a lot of other people confuse multidisciplinary and interprofessional. When we in education and health professions education are thinking about multidisciplinary, we're talking about different disciplines within a profession. So if we're doing education on acute coronary syndromes and we have emergency physicians, family physicians, clinical cardiologists, and interventional cardiologists, they're all physicians, but they're from different specialties and different disciplines. That's what we mean by multidisciplinary. Some people use the term interdisciplinary for that, but most people use multidisciplinary. If you go to the UK, you know that they have multidisciplinary team meetings, MDT meetings. But actually MDT meetings are what we mean interprofessional. Interprofessional means multiple professions. And like you guys have been asking me, multiple professions means not just physicians, but nurses and pharmacists and all of the other professions you can think about. But to answer one of the questions that came up earlier, somebody asked, what professions are included in interprofessional? There's no list. There's no list that says these fit into interprofessional and these don't. it's really dependent on the environment that you're in and what you're trying to accomplish. So if you're talking about the patient journey, everybody that has a role on that patient's journey, whether in a hospitalization or over the course of long-term disease management, makes sense. So it could be therapists, it could be non-health professions people, it could be business people. And somebody said in that question, is the patient part of the interprofessional team? Absolutely, absolutely. Shared decision-making is critical. I did a study and published it with my colleague, Kathy Chappell, who's one of the leading nurse educators. Ujjwal, you probably remember her. She was my co-presenter at the presentation skills session. But we did, we developed interprofessional continuing education faculty training. We did it all over the world. This addresses another question. All over the world. And we used role play. And we brought lots of different professions in. And we had 9 or 10 different roles, including patient, patient's family, caregiver, advocate. All of them were involved in developing educational activities. If anybody wants that paper, I will send it. One of you can compile an email list, and I'll send you the paper that talks about it. Because we did it in North America, Europe, Asia, Australia, and Middle East. So, and we had complete acceptance of all professions, and no hierarchical problems. No, this one doesn't belong, that one doesn't belong. So it's a long-winded way of saying there's a lot of different professions. It's really context driven. Okay, and you guys are great because interprofessional education, the best model starts early. It starts when you guys are students, and IPE, you'll see in a minute, is student-based. It's when students from 2 or more professions learn from, with, and about each other. Postgraduate, when you're in your training, it's really important that you think about how best to work together with a team. I remember when I was a medical student and when I was a trainee, there were a lot of people who said, I'm not going to listen to the nurses, I'm not going to listen to the pharmacists, I'm going to listen to only the doctors. And boy, did they lose out. They lost out big time. Because I remember there was one nurse, and I quote her all the time, Viola Mann, at a hospital in Brooklyn, New York. And she said to me, if you listen to me, you'll know every answer to every question that you're going to be asked on rounds. And so I looked like a superstar. And all of my friends who were a little bit obnoxious and a little bit snooty did not look as good. So if you think about it, if you learn from, with, and about each other early throughout your training, once you're in practice, you're going to be a more effective teammate. And being an effective teammate is really important. The idea of this is not new. It's over 40 years old. And so this timeline is just to show you some of the publications that came out from incredibly powerful organizations stressing the importance of teamwork, team-based education, team-based training. I don't know if any of you play sports, but if you play sports and you only train by yourself and then you go to play as part of a team, you're never going to win. A lot of you probably like football. We call it soccer here in the US because we have something else that we call football. Very strange environment indeed. But if you play football, there's a great quote that says, you practice 40 hours a week to play 2 hours. And if you think about it, do we even practice 2 hours a week in medicine and healthcare to practice 40 or more? So it's really, really important to think about. So it's always been known, just hasn't been done. And so there's really hope for the world because you guys are interested in asking about it. And the fact that there's 36 of you on this right now, where you have lots of other things to do, and the conference starts soon. And by the way, if you want to watch something entertaining, I'm opening the conference at 7 a.m. UK time, and I was supposed to be doing it in Glasgow. But guess what? I'm here in the US. It's going to be 2 a.m. my time. So let's see how good that goes. Feel free to tune in and laugh. But when you think about the current healthcare environment, it is all patient-centered in many places. It is all about teamwork. And teamwork involves really working well together, respecting each other, knowing that there needs to be a team leader at times, and the team leader doesn't necessarily get defined by what profession they come from. And if you remember that, you're going to be a much better healthcare professional. It's so important to be humble and to appreciate
E as pessoas finam
somebody needs to mute because I'm hearing their conversation.
Yes, Iram, please can you mute yourself?
By the way, if anybody would like to borrow one of the books behind me, this picture is from Harvard University, so you have to go to Cambridge, Massachusetts to get the books. But if you look at some of these headlines,
you will hand it to us if we go?
I will meet you at Harvard if you go.
All right.
It's very interesting.
One hour for me to get there. We have lots of friends there. But if you look at some of these headlines, if you think about it, many medical errors and health professions errors can be avoided with good teamwork and really making sure that you follow a process. I don't know if you guys ever watched the TV show ER when it was on, but in the very last episode of the show, when it was going off the air, one of the younger physicians was going in for a kidney transplant. And one of the more senior physicians, who was his friend, was sitting in the OR. He wasn't part of the team. And the transplant surgeon just said, okay, let's get started. And the friend pulls out a card and said, let's go through the checklist. And what's really important is to make sure that whoever's in charge of that checklist on the team, make sure that checklist is done, because maybe you won't remove the wrong kidney, or maybe the baby won't die. So I think we need to remember the importance of why we need to work well as a team. If you haven't seen the TED Talk by Simon Sinek on the power of why, I strongly encourage it. It's all about why. Now, I don't know if you know this guy, Atul Gawande, very famous surgeon here in the US and I think worldwide, but it's very interesting. He wanted to self-reflect, and he hired someone, a surgeon, to follow him and to make notes and to give him feedback on how he was performing. And so he met with this person and appreciated all of the feedback that he got. And then, because he's a good teammate, shared it with the team. And do you know what the people on the team said? They said, we could have told you that. All you had to do was ask. So you can rely on the team. You can trust your team. You need to think that you're in a safe environment with your team. And you don't need to look outside. You can look within. So that's the beauty of thinking in an interprofessional manner. This would take me 5 hours to go through. But Weaver in 2010 talked about how do you develop effective continuing education. And even though the focus wasn't about interprofessional, one of the you can see in the second line from the bottom, incorporates team skills in practical ways. So if you think about it, no matter what you're doing, when you're doing your lifelong learning and when you're learning after your formal education is done, you need to still remember how to learn uniprofessionally and interprofessionally. Does this make sense to you guys? I want to take a break and just ask you.
It does.
Yes.
Makes sense, yeah. I just have a quick comment. Maybe we as students sometimes, since we're talking about surgeries and stuff, we as students, we're just a tiny piece when we get like to participate in a surgery. And many times I have find that we're not really part of the team, like we're just a piece that is like being present there or maybe help with something, but we're not part of the, you know, the diagnosis or the surgical technique that's going to be used or the checklist even or things like that. So how we as the minor piece and the lower in the scale, because we're just students, can we like advocates to be part of that team, for example?
So Kevin, I love that question. And I want you to change the way you think about that, because you are not a minor part of that team. You are as important as anybody else. Your main function on that team is learning and support, but you're a part of that team. So one of those challenges is, and especially in procedure-based education, there's a lot of well, this is the way we've always done it. This is the way we've always taught it. This is the way I had to learn, so it's the way you have to learn. And it often helps to try to find an advocate within that department or an advocate within your school who you can talk to one-on-one, so that it's not, again, it's supposed to be a safe environment. You're supposed to be able to give 360-degree feedback to your clinical instructors. But to be fair to them, a lot of clinical instructors have not been taught how to be effective educators. So they're not seeking to create that teachable moment. They're not as skilled as others in bringing you in and saying, how can you participate as part of the learning process? So one of the things I always encourage people to do is find an advocate within that department or another department. If you have a great mentor, mentors are really great at helping you to either develop and have that difficult conversation yourself, or have that difficult conversation with you. But if you demonstrate to strong academic faculty that you have an interest, that you have an acumen, that you're not trying to do more than you're supposed to do, I think you have the opportunity to be a better student. There's a talk that I give sometimes, is how to be a better learner, and it's all about that, Kevin. And so the first thing you did is you did what Aristotle said earlier, is you looked at yourself and said, how can I have a better learning experience here? That's what every one of you should do every single time there's a teachable moment. And so if it's something you're interested in, so let's say you like surgery or ER or some other procedure-based specialty, I encourage you to find someone to sort of latch onto, and even if it's outside of your institution. So you may be able to incidentally, it's called incidental learning, bump into somebody at a conference or someone else who may well be able to be your advocate and say, oh, I know that teacher, I'll give him a call, or I'll give her a call. Just something to think about. Hope that was helpful. Ala, do we have any other really awesome questions before I continue to move on?
I have my eye on the chat, but not yet. I would also like to take this opportunity to encourage you to ask, and I'll be following through.
Okay, I will ask, because I'm not shy, because I can't be shy. So when we think about interprofessional continuing education, so that's CPD, that's team focused, and it involves two or more professions learning from, with, and about each other. It means that they have to be involved the whole time. Same thing with undergraduate, IPE. You need to be planning the education and have the education be centered around what all of the professions have identified as being the need. So for instance, if a physician develops an educational program about diabetes, and there happen to be physicians, nurses, pharmacists, and others in the audience, that's not interprofessional education. That's a program developed by a physician that has an interprofessional audience. To be real interprofessional education, it has to be planned, delivered, and for the team, from, with, and about each other. So you need to make sure that what you're trying to do is you're trying to encourage the team to identify team-based needs and then develop the education to address that. So how do you do this? This goes to the question, actually, Kevin, that you asked before. This actually speaks to that as well, which is how do you get this stuff done? And that was one of the questions that we got on the 5 that came in already, which is, how do you get this into place when you have the senior staff, you have the senior faculty who are not on their own embracing or instituting interprofessional education? How do you do it? You need a champion, and you need someone at the top who can be that leader as well as be supportive for you and help you to bring that into the program. And it needs to be systematic. It needs to be organizational. It can't just be one person. It may start that way. You may find that one person or one specialty or one team develops it. And what you find is a variety of outcomes, right? So sometimes people say, look what they're doing. We don't ever have to do that. Others may say, wow, that's pretty cool. We need to bring that into our department, specialty, et cetera. But what you need to do is move from the champion to incorporation, to pilot testing, and build off the positives. So the successes, what were the successes? And make the measurements, make the outcomes measures easy. as a result of this education, we're planning this education so that this change will take place. More effective communication between the team when a patient is admitted. More effective communication between the team when a patient is discharged. Decrease in the number of times a patient is asked the same question in a 5-minute period. All of those things are things that you can easily build into education if those were the needs that were identified. Few things to think about. The outcome, right? So you're trying to get this interprofessional collaborative practice or interprofessional learning. Everybody on that team has to feel like they belong. They have to be respected and that they're an important part of a team, not, Kevin, the add-on. And that's sort of that important point. And they have to think bigger picture. Now, this doesn't mean that there's not a need for single profession education. There are things that we have to learn individually, but there are also things we need to learn interprofessionally. And it's really important. And that last bullet point is really key. And we hear this all the time when we talk to people who are struggling with incorporating interprofessional education or struggling to find a way for the team to learn better together, because sometimes there's that lack of trust. And finding the ability to build that trust between professions, between people, because this is all people, right? It's not just the professions, there's people in the professions. They have to be able to trust each other. But everybody needs to have an equal seat at the table. That bottom left, they're not playing poker there. That's supposed to be a boardroom. But everybody has to have a seat at the table. And guys, I want you to start thinking about questions because my slides are almost done. This is meant to be about you. So hopefully I've started to stimulate a few things. Before
Yes, we have one that just landed.
Uh-oh. It just landed. Is it from a spaceship?
Yes. Well, it is a very good question. And if you would prefer, you can finish your slides or I can ask it now.
Ask it now.
Perfect. So Michael from Brazil is asking, is there sufficient evidence in non-medical health professions education? Can we apply what we know about medical education to other health professions education as well? I'm not sure if this question is clear to you, Lawrence, but Michael is also here to clarify more.
Yeah, so I think I understand the question. Let me play it back. And if I'm wrong, Michael will certainly fix it. I think the question is, outside of medical education, but in other health professions education. One, is there data or are there data? And are there things we can learn from each other in that education? Is that what you're saying, Michael?
Yes, it relates to a problem, not kind of problem, but we have in my university a medical education course for students. And we are other professions, for example, pharmacy and nursing would like to participate, but it's hard because it's all about medical education and we couldn't find actually literature about it, about other professions. There is not much.
So right, there's a lot of nursing education literature, I can tell you that. There's a fair amount of pharmacy education literature as well. But what I can tell you is you can point to AMEE, the organization, as an example. Because although it's called the Association for Medical Education in Europe, if you look at the variety of professions that submit abstracts, that present at the conference, everything from nursing and pharmacy to veterinary and dental, because the basic principles of adult education, learning science, health professions education, they're profession agnostic. Now, there are certain skills that you need to be able to do and teach within individual professions. And even there, it's within individual specialties, right? So how to do a CT with a contrast is not as important to someone who's a pathologist as it is to an interventional radiologist. So, but the basic principles of education, adult education, learning science, and health professions education are across all professions. So what you could do is you could say, why don't we pilot it and take one student from nursing, one student from pharmacy in the next course and ask them to give their feedback and say whether it was relevant or not. And if you do that, then you've got your evidence from, not from the outside world, but from within your own organization. And I'm sure you'll find someone to champion that.
Perfect, thank you.
I just made it up, but it sounded really good. So guys, there's half the time of this webinar left for questions. So I can go back to the questions that were asked in the email, but if anybody has a question now, if I brought something up that you were thinking
Yes,
about.
you did.
Go ahead.
We have Eleni, Selma, and Iram as well who have questions. So Eleni is mainly asking, how can we incorporate patients into undergraduate IPE? And I think it goes in line with Selma's question on how to make sure that everyone has an equal seat at the table in ensuring that curriculum development does incorporate professional education.
So I don't know if any of you knew this, but my TED Talk in 2011, when some of you may still have been in primary school, was about incorporating patients in medical education across the continuum from medical school all the way through CPD. So it's not the easiest thing in the world to do, but you have to think about the why and the what's most important. So a lot of medical schools have started clinical work earlier. And a lot of medical schools have started access of medical students, even first-year medical students, to patients and the patient environment. What needs to happen is the faculty need to do their own needs assessment and say, okay, what patient-level skills do these students need to have at this level and at this point in their education? And then build that voice in. It's not an open call for, hey, patients, what do you think these people need to know? Because that may not be a competence that either the patient or the student has yet. But if you do it in a very structured approach and you conduct the needs assessment and you ask the students, what is it you wish you would have known? And you ask the patients, what do you believe they should have known? And you do it contextually and appropriately, then there's a way to build that in. And it also has to do with what are the expectations and what are the outcomes. So you don't just automatically say, okay, we're going to build the patient voice in here. The same way you say, we're going to build the administration voice in here. We're going to build the pharmacy voice in here. You have to do it with an absolute rationale and do backwards planning. Say, our goal is to accomplish X, and here's what we're going to do to get to X. I hope that answered the question.
I hope it did. And well, if it didn't, then of course you can ask follow-up questions now. We also have a question from Iram. She says, when I think of IPE, I imagine it more in clinical years. Can we implement it into preclinical years? And do you have any advice how students can take the lead?
So that's a great question. There are examples around the world of some preclinical courses that are interprofessional. The rationale is, is there a reason for the professions to be learning this together? So maybe doing something like anatomy or physiology or biochemistry may not make as much sense, but maybe pharmacology does. Maybe parts of pharmacology do. So maybe some of the professions, certainly medicine and pharmacy, need to think very deeply about mechanism of action, kinematics, PK, PD, all that stuff, right? Maybe nursing less so, unless nursing has prescribing in their ability where they are. So it's a matter of where you are and what it is that you think you can learn together. But there are also the opportunities to build specific interprofessional courses to say, okay, introduction to teamwork, introduction to certain topics. I would say that I would bring people together when they learn BLS and ALS. I'm sure you take ACLS and CPR at some point in your preclinical years to get you ready for your clinical years. Very good idea to bring together all of the professions because everybody has a role when you run a code, if you think about it. It's a great environment. Plus, it's one where we know we have great simulation models so that you're not practicing interprofessional teamwork on someone without having tried it on a simulated model first. Hope that answers that question.
I think it does, and I actually agree a lot because one of the things that I've noticed personally from learning or seeing my faculty trying to implement interprofessional education is that people struggle to learn together when they're actually put on the spot immediately, and probably having more of those team-based learning and those sessions early on in preclinical years would be helpful. Now, the chat box is happily exploding. So I was wondering, would you like to just finish your final slide and then we open the floor? STF can directly ask you, or should I continue?
Well, actually, I want to wait to show my final slide until after we finish all the questions. So this is the perfect time for the explosive content to hit the screen.
Perfect. So I think Utku had put in an eye. Does that mean you would like the chance to speak, Utku?
Yes, if possible.
Of course, we welcome that.
Thank you. So I was just thinking that we spoke a lot about why question, but now I think how question, how to implement these things in the medical students, or especially when it comes to the multidisciplinary pharmacy students and nursing students. So the thought has came to my mind that why don't we put this in, and incorporate into the accreditation system so that everyone in the whole country could actually benefit from it. So I was wondering how we can do this.
Well, first of all, Utku, merhaba.
Merhaba.
Thank you for the question. So there's a few things. It takes years and a lot of politics to incorporate multiple professions into an accreditation scheme, right? So I think you have to sort of work backwards and take baby steps. So if you have advocates from each of the professions and you have examples from multiple institutions where you were able to start the process to say, we were able to learn together and say, here's the data, it worked here. And if you have the evidence, you know, you're in a profession now where everything is evidence-based, right? So you have to build the evidence base, and you have to do that. So maybe you can get an advocate from the Ministry of Health, and you can get an advocate from your school or several schools and say, we'd like to pilot this to see how it could work, and bring in people and models from other schools and other places so that you're not saying, well, we came up with this idea, but it's never been done before. Now, maybe the accreditation hasn't been done before undergraduate, but certainly you may not have to get to the level of forcing it through accreditation. You may just be able to model it. Now, I can tell you an example of interprofessional accreditation that does exist. It's at the CPD level in the US. Medicine, nursing, and pharmacy came together and said, we all believe in the same principles of CPD development, implementation, and assessment. So why don't we work together so that organizations that want to be accredited to deliver CPD can have a single unified process and be able to give out team-based credit, but also individual professions credit, and the professions and the accrediting bodies had to trust each other, right? And so this was a hard project. It's now been in place for 10 years. There's over 100 organizations that have this joint accreditation, and they now have either 7 or 8 professions. So not only is it medicine, pharmacy, nursing, but it's optometry, physical, physician assistant, social work, psychology, have all joined in. So now think of it. One organization, one university wants to get accredited to deliver CPD content. As long as they can demonstrate that 25% or more of their CPD education over the past 18 months has been interprofessional, by definition, they qualify to apply for that. And think about that, 7 or 8 professions together. So there's hope. There's hope, Utku.
Utku, I hope that answers your question.
That was 2 thumbs up, so that must be yes.
Perfect, great. Okay, looking up next, we have, Lauren, somebody I think is very familiar with your TED Talk and the link in the chat as well. So we have Abhishek from India, And do you want to ask your question, Abhishek, or should I read you?
Yeah, I'll go ahead. So, I was asking Dr. Sherman, what's your way of dealing with a disagreement within our team based on evidence, or what's your way? I would like to know that.
So disagreement within a team. So can you expand on that? Because I'm not sure I understand completely what you mean by that.
Yeah, like, so because medicine keeps changing on a day-to-day basis, literature keeps coming up on a daily basis, and there's always one person who is ahead of all of us, and he would be of a different perspective on some guidelines. So
Yeah.
based
So I conflict resolution 101. That's always a challenge, and there's a lot of literature on readiness to change, and it's by this guy named Jim Prochaska, and he published early on that there's a bell-shaped distribution of people who are ready to change. Some, like me, when they hear something at 1 o'clock in the afternoon, by 3 o'clock want to be able to do it. There are others that take a year or longer to do it because they want evidence. They want to see that everybody else in the world has made the change so that it's safe and effective and there's no risk. So the reality is that's a huge challenge, and it really varies organization to organization. If it's someone who's less experienced and is challenging a more experienced clinician, it's often more difficult. When it's an equally experienced clinician challenging another one, then it's more a matter of a professional conversation, making it a safe space, and having a discussion to say what are the risks and benefits. Now, obviously, if it's a life or death situation and it's a critical decision, someone's going to have to step up and make the decision. If there's time to work through it, I think this is the opportunity, whether it's uniprofessional or one discipline, one specialty within medicine, to say, okay, let's look at it and see which is best for the patient and why, and have that conversation. If it's within a teaching environment, it could be a great opportunity to make it a teaching question and bring others. As Kevin was saying, I would like to give the role to the most junior person on the team and say, hey, what decision would you make and why? And use that as a teachable moment. There's no real answer to that question, though, right? Because you want to avoid bullying, but you also want to avoid missing an opportunity to do something that's right for the patient, even though the data are so new. Ala, back to you.
Yes, back to me. And I think I agree a lot with that. Also from observation, I think teams tend to get a dynamic in place, and in interprofessional teams quite differs, but of course the main concepts are there. We have Ujwal having a question again. I think it was on curriculum. How does a curriculum that incorporates interprofessional education in undergraduate education look like? And if you could give us practical examples. Ujwal also had a follow-up question after, so I think I'll let you answer this one, Lawrence, and then Ujwal can ask his other follow-up question.
Well, very, very easy for me to answer the first part. That's not my area of expertise. And so I'm not an expert at undergraduate curriculum building, but I'll refer back to what I said earlier. It's the faculty's job to assess where and at which parts of the curriculum there's an opportunity to incorporate some or all within a course of interprofessional conversation. I don't know beyond that what I can offer here in this setting, but certainly I can do a little bit of research and after the fact send you some examples of where some undergraduate organizations have incorporated some interprofessional. I'll make a note of it. See, I have my Apple Pencil right here. And what's the follow-up question, Ala?
Yes, Ujwal, over to you.
Thank you, Lawrence. So it's not really a follow-up question, it's more of a standalone question. So in the setting where I come from, preconceived notions of a hierarchy within the medical team, within the medical workforce is a big problem to teamwork. For example, we have some doctors who think they are somehow more superior to nurses or other professionals. And this has created a state of tension between different professions. So how are the teams supposed to get over this and create a safe, amicable working environment?
Right. So it's sort of working backwards. That environment should never have been in place. But since it is, I think there needs to be a combination of human resource involvement. So it's not just, you know, the department working on it, but there's got to be a cultural shift, and there has to be a champion at the highest level to say this is not okay. Everybody has an equal seat at the table, and there have to be, in my experience, departments and examples and champions who are doing it. And so you're not just saying, well, we're bringing this in out of the ether. Here's examples of within our own institution of where it is working, and here's where, you know, where maybe there's an opportunity for you to improve, and maybe someone from that department can work with the other department. The reality is, it's got to be that what I laid out before. You've got to have that champion. You have to have the supportive leadership, and you have to make it the environment. Everybody has to feel safe, right? You know, there's also the backwards issue of safety. The backwards issue of safety is, I was in Israel doing a medical education lecture, and somebody brought up an interesting point. They were doing CPR retraining, and the attendings, the consultants, didn't want to be in the same courses as the people that they were training, because they didn't want to admit in front of their trainees that they may not have remembered the basics of BLS. So, you know, there's a lot of safety issues. It's not just those who may have once been lower on the totem pole who feel unsafe. There's a lot of safety factors in the 360-degree environment. But you need a champion, and you need leadership to stimulate an environmental and cultural shift.
Thank you so much for that answer. And I think a lot of people resonated with Ujjwal's question. At least we had from Sudan, India, Peru, Morocco, and Nigeria as well. Now we have a question from Azhar from South Africa. Do you want to ask your question, Azhar?
Ada, can you please ask it?
Oh, of course, yes. So Azhar says, at my university, the first 6 months of medical school is spent with several programs, such as medicine, physiotherapy, occupational therapy, nursing, dietitians, and midwifery. I believe having 6 months of interprofessional education helped us to understand and conceptualize how we can work together to institute holistic patient care. Okay, so I missed the question part of this, but I think it's very amazing to have the experience shared from South Africa. I think from KwaZulu-Natal University. Please correct me if I'm wrong or if I mistook that, because we have 72 STF members. But Lawrence, do you want to comment on this positive example?
Oh, I love it. And I think, and I hope that someone is publishing this somewhere and presenting this somewhere, because Ujjwal, there's your example, right? I mean, I think you guys should connect and see that this is, Ujjwal, this is incidental learning, right? We didn't intend for someone from South Africa to give you the answer to the question that you asked me, but they had a better example. So there you go. I don't have to follow up with you now. I was going to say, oh, give me your email address, but now I don't need it. So I love that example, and I think we could learn a lot from that example.
Perfect. And just to correct, it's Stellenbosch University. I mistook that for the other STF member we had.
Whoops. Okay. Do you have any more questions for me?
I think my internet glitched.
It had a bit of a hiccup, yes.
Yes, I think it glitched because I lost the screen. So Andres is asking, at my university, they want to start IPE through peer teaching after lectures and using case-based learning. Do you think that's a good start?
I do. I think case-based learning and certainly peer-based learning are two ways that IPE can stand out from traditional basic science courses, for instance. So cases represent what we do in reality. As adult learners, and believe it or not, guys, you're all adults now. As adult learners, teachable moments and problems come up from practice and work. So that's the best way to really build education that's going to be impactful, and it's called germane, right? How can it be relevant to my world, my practice, my environment? So as long as the students are at an even level of how they're learning and practicing, case-based learning can be great. And I think peer-to-peer education is really great because you're not being told what to do from someone who's saying, here's how you need to do it. It's peer-based education is usually, here's how I've done it, and here's what's worked for me and what hasn't worked for me. I try to do that at every level, but not every faculty member can do that or does that. So I think that's important. So thank you for that great example and that question.
Mm-hmm. Thank you so much for that answer. I'm wondering if I can give my own question at this point before I forget it, but I mainly wanted to ask about workplace-based learning and CPD.
Uh-oh. Uh-oh.
Hear you, Ala.
We just lost it at the best point.
Learning in many contexts. Oops, it glitched again. I'm really sorry. Can you hear me now?
Yeah, we heard you say, can you tell us about workplace learning and CPD? And then this is what you said.
Oh, okay. So I wanted to ask a more specific question to say, we know for a fact that assessment drives learning. And have we considered having more assessment-based approaches towards professional education in workplaces, in CPD, and so on?
So it depends on what you mean by assessment. So in CPD, you're supposed to do an assessment before, during, and after any educational activity. I published a paper on this 2 years ago with Don Moore, where we talked about the 7 levels of assessment, and we talked about how do you design effective education to meet those levels of assessment. If you're talking about assessment as a clinical skill, that's a different story. And certainly in the non-COVID environment, having assessment as a skill and a tool is incredibly important. So Ala, which of the 2 assessment definitions do you mean?
I mainly meant, I think, because usually, at least in Sudan, we have registrars who are in training, and they do coincide with also clinical pharmacists who are in training, and also midwives who are in training. But however, it seems that everyone has their own different training and do not meet unless in front of the patient and have their own different assessment to gain their final degree. So that's the main intent behind my question. But yes, you did answer my question.
Oh, good. I answered it. I didn't even know it. So that's good.
Yes, and you did guide me to a direction to go and read, which is even much more better. So we have a question from Iram who says, how do you see the impact of hidden curriculum for IPE? Is it helpful, or should formal curriculum be the ideal approach?
So there's an important place for both formal and informal incorporation of IPE and IPCE. And I think it happens and we don't even realize it. Informally, we're having conversations and discussions with people all the time from across the professions. Either, let me tell you about this patient I just saw, or in the non-structured setting, what do you think about this patient? How do you think we should approach it? Or, you know, one of the things I've learned, there were some nurses that I worked with that would say things to me like, this patient's gonna crash. I can't tell you why, and there's not a lab test that we can order, but I can guarantee that this patient is not going to do well overnight. And you know what? They were usually right. And so sometimes that informal, instinctual conversation is important, but I also think there's a very important role for building in the formal parts of interprofessional education, so that, because if we're doing it right, we're planning it, implementing it, and evaluating it from, with, and about each other. So it can't just be, well, it happened. And it can't just be people came and participated. It has to have been planned that way. So there's got to be proactivity. So I think there's two parts to that. The informal part that's important, and I think the informal part supports the formal.
Terrific, sir. So I had intentionally skipped a question from Gladys because I felt answering that question would be a beautiful wrap to the webinar today. But before I answer Gladys's question, or actually ask it to you, we have a question from Michael, who says how to make formative CPD rather than summative CPD. I'm not sure I understood the question, but I hope you did, Lawrence.
Yeah, so there's formative assessment and there's summative assessment. And so in the paper that Don Moore and Kathy Chappell and I published 2 years ago, we talk about a continuum in CPD, where it starts with a needs assessment that you use to develop the education. Then you implement the education, but during the implementation, you use formative assessment to say, are we hitting the mark? Are we doing it right? We can change it. And then at the end, you still need summative assessment to say, did we hit the learning outcomes that we were aiming at? So it's not an either or, it's a how do we make sure that we use a model and we put together a framework. How do you use a framework that can be assessment-based from before, during, and after? And how can we effectively develop the educational activities that will use that framework? So it can be done, and if you want, I can send you that paper.
Amazing. Final question, and I think this would be an excellent wrap. So Gladys is asking, do you have any suggestions on how students can go about introducing and advocating for the importance of interprofessional education in their faculties, especially that this is not a known concept? And is there any line of literature or resource you recommend to learn more about this?
So there's a fair amount of literature, and if you did a literature search sort of tomorrow, you'd see a lot of it in the undergraduate spaces and a growing literature in the CPD space. But the best way to do it, again, is to go back to a couple of things I said earlier, is you have to demonstrate from evidence. So it's not just literature, but examples of where it's working. So whether it's the curriculum from South Africa, or if it's from things that you heard at AMEE. So you could look at all of the AMEE presentations that focus on IPE. You can look at, there are conferences that focus exclusively on interprofessional education worldwide. There's Altogether Better Health, ATBH. So that's an interprofessional conference. And so there's a fair amount of research, scholarship, and literature in interprofessional, and put together a strong case. It's almost a business case to say, here's why we think interprofessional is important. And if you can get an advocate and a champion within your own organization or your own university, I think it makes it that much easier. If you're a lone voice, it's often very difficult. So with that, I know we've reached 1 minute past the hour. And what I'd like you to do for me now, and hopefully, Ala, you can send me a copy of the chat box afterwards, is I want everybody to put one thing in the chat box that they're going to take away from this webinar. If you want to put more than one thing, that's important. But to me, I like to be able to reflect and say, what did people pick up on? What was important to them? And please, if there's something I can do to improve this, if I do this again, tell me, because I want to grow as well.
Thank you so much, Lawrence. And I'm pretty sure the STF are now typing all their points. Once again, from all the STF coordinators, we're extremely happy to talk about this important topic to all of us. And we're also very excited to see you tomorrow at 2 a.m. for you, and hopefully not 2 a.m. for all of us. That being said, thank you so much, and we hope to interact with you again.
Well, I told you, I love the student task force. If there's ever anything I can do for you, don't hesitate to ask.
Thank you, Lawrence. Really great.
Very inspiring. Thank you.
Thank you, Lawrence.
A lot of ideas for work for us.
Yeah,
Yes,
and Michael,
definitely.
Michael, I got your email. I'll send you those other email addresses shortly.
Okay, thank you.
And I see Eleni from Greece is clapping, so I'll say Efcharisto.
Παρακαλώ.
I'll say Shukriya and muchísimas gracias and every other language I can think of.
Okay, so I'm now taking note of the chat and sending them to you in a bit.
Oh, good. And I'm watching all the thank yous. Oh, that's a new one. Danyawad. Ah, Barca. Oh, I love this. This is great. This makes me happy. Ah, muito obrigado. De nada. Ah, mamnun. Oh, this is great. I need this whole transcript. You can save chats and you can save chats if you just put one more A in there, like a papi chat. I also speak food. Ooh, that's a new one. I don't know how to say that one. You like that, Mokshada. Good. Uh-oh, that one I'm not reading.
Yes, that's a challenge intended from Naveen. Great. About it for the chat, then I think we can call it a night for us, definitely, and an afternoon for you. Once again, thank you, Lawrence, and see you tomorrow.
Take care, everybody. Thank you.
Bye-bye.
And good luck to you.
Thank you,
Good luck
Lawrence.
to you. And any of you that are working on the social media, thank you, thank you, thank you. And if you have any questions, I sent you an email. You can email me directly.
Yes, and we will be adding you to a group with Lawrence right in a couple of minutes, where you guys can talk more.
Oh, Mokshada, does that mean I'm now an official student? Do I get a t-shirt?
What size? We will send it. Oh.
I ask every year and I never get one.
That's extremely sad. We are having a backup plan for STF t-shirts this year, but even if that backup plan doesn't work, next year you will get one for sure.
Well, thank you. And Allah, you did a fantastic job being my co-pilot, my navigator, my wingman, everything in one.
Thank you. We are trying to model what you're already reflecting to us. And I think this is one of the things that I took back from the presentation today or webinar today, that you do not need a lot of things to be engaging. Simple and very interactive way of facilitating. So I'm impressed. Thank you so much, Lawrence.
Thank you. So I think what you said is I don't have a lot and I'm simple. So that's perfect. Thank you.
It was meant in a very positive way. I do not know how it got into a negative one.
No, it's fine. See, the one thing when people say to me, what was the best training I had to be an educator, was being a stand-up comedian in New York, because there's not anything that could throw me for a loop. So, you know, that was, so when you say something.
Now everything makes sense.
Yeah, see, there you go. My brain works a little faster than my mouth. So then I have to sometimes reverse that. My mouth works faster than my brain, and I need to be very, very careful.
I feel like anyone wants to like leave the chat. We're all still here.
Yeah, I noticed that. Yeah.
Yes, of course. We don't want to leave.
Well, I just have some books to read. I think now it's time to.
Glitched.
Uh-oh, what happened?
Oh yes, back. My internet does this funny thing where it disconnects for a second every now and then. But yes, you were saying something, Lawrence. Sorry.
No. I was just saying I'm enjoying this, and it was time to change my background to where I'd rather be.
Oh, that's amazing. It was also very great to be at Harvard virtually.
Well, it's a wonderful place. If you ever get the chance to visit it, it's fantastic. I had the opportunity to chair a conference there, and it was just spectacular.
Amazing. So thank you so much, Lauren. We have successfully saved the chat, and we will be emailing it to you shortly. Bye-bye.
Thank you. And thank you, everyone from around the world. You are my favorite people.
Thank you.
Bye, Lauren.
Thank you. Bye-bye.
Bye-bye.
Bye, guys.
See you at the conference,
Thank you.
Lawrence.
Bye.
Find my avatar at the conference. It's fine.
Okay.
We definitely shall.
Bye.